My name is Chloe Debus, and my final paper was about making vaccinations mandatory for all cattle at the time of purchase and to have these vaccinations performed by a DVM, or Doctor of Veterinary Medicine. Over 91% of children in the United States are vaccinated as infants against major diseases such as the measles, polio, and chickenpox. A majority of Americans vaccinate their pets as well, especially puppies and kittens. There is nearly a 100% vaccination rate against rabies in the United States. However, only 68.9% of cattle operations vaccinate any beef cattle at all, even though these are the animals that we raise and eventually consume. Vaccinations for cattle are not mandatory in the state of Colorado, though they are highly recommended. If these vaccinations are decided to be given, they are usually done at home by the rancher themselves. They can be performed by anyone. There is no veterinary or professional knowledge required. This means that vaccinating can be very dangerous and it leaves a lot of room for error. Fortunately, there is a better way to do it. The seller can hire a veterinarian to be on site at the time of sale, and the buyer will agree to pay a vaccination fee that is a set price for each bovid or animal. This plan is cheaper than vaccinating at home, less dangerous than vaccinating alone, and it is easily implemented within the beef industry. First, this plan is cheaper than a rancher vaccinating at home. Medications would be bought by the seller in bulk, and when medications are bought in bulk, they are actually cheaper than being bought in less dosage amounts. Typically, medications can be bought in 10, 50, or 250 dosages, and ranchers will not have to buy more than they need. There will be no wasted dosages, since ranchers will only pay and vaccinate the number of cattle that they have bought. For example, a rancher who only has 5 cattle needing to be vaccinated will not have to buy the 10 dosages, he will only need to pay for the 5. Next, professional personnel and the correct equipment will reduce the risk of danger for both humans and cattle. With a veterinarian, there will be no incorrect injection placements, which can lead to bleeding or major injuries within the cattle. The veterinarian will be aware of the weight of the cattle so they can inject the correct dosage amounts to make sure the right medication gets into the cattle. There will be the correct equipment on site, such as chutes and holding pens, to create a less stressful environment for the cattle and ease of vaccinating, doctoring, and access for humans. This will allow both humans and cattle to stay calm and to move safely within the area. Finally, this plan is easily implemented. All it takes for this plan to be implemented is for the seller to determine a vaccination fee amount and to hire a veterinarian to be on site at the time of purchase. A buyer needs to agree to this vaccination fee and pay this vaccination fee when they also pay for their cattle. Clearly, it is obvious that vaccination within livestock is important, and it is important that it is done well and correctly. Mandatory vaccination by a DVM, Doctor of Veterinary Medicine, saves time, money, and stress. We need to love, protect, and care for cattle as much as we care for our pets, as well as ourselves.